Wow, good evening. How's everybody tonight? Yes, I'm truly honored and humbled to have this opportunity to share this moment with you, with these fine young people and colleagues of mine. And Yusufa, thank you so much. I'd like to thank the Alberta Liberal Party for welcoming me back, and I'd like to thank all of you tonight for attending. Start off with just a brief story. I was 2 months old when my father left our village in India to make a better life for his young family. I grew up on a farm. My mother, her father was a sugarcane and dairy farmer and a rural family doctor. In 1972, my father brought myself and my pregnant mother to Canada, to a small town called Squamish. It was a struggle at that time, being a new Canadian, had to learn a new language, new culture, and it's cold here, I'll tell you, where I grew up. But my parents worked hard. Dad worked in the mill, Mom cleaned toilets and cleaned hotel rooms. I worked in the mill, cleaned hotel rooms. In the early 80s, life was tough. I couldn't afford university education, and I had a 98.6% average. I got busted for shoplifting food when I was 18, because I was on welfare. It was that tough. In 1984, I packed my bags and came to Alberta. I had a full-time job working night shift in pre-med. Because the parents taught us the value of hard work, hard, honest work. I had made a mistake as a young person. But I got through medical school. I've been at the Royal Atlantic Hospital down the street for 20 years, looking after the average Albertan. After 100,000 patients in the front lines, we saw problems. It's not an ER problem when you're there, it's a healthcare system problem. No family doctors, our seniors aren't looked after, no long-term care, but it's actually greater than that. It's a societal problem that sits in the hospital's emergency rooms. Homelessness, poverty, addictions, the effects of mental health, violence in a community, mental health issues, the effects of an economy that's booming too much or not booming enough. That's why I ran for public service. I told the Premier I had never voted for his party because they wrecked healthcare. He made a commitment in writing to listen to frontline health providers. He said, Raj, change the system from within. I think you all know what happened. They broke their word. I was faced with a moral and ethical decision, and the decision was easy, and I knew what my punishment was going to be. I'm the one who leaked all the cases. People were dying in the waiting rooms. I said, I'm not going to sit here anymore. The public has a right to know this government was a threat to public safety. I'm running for public service because I'm not done yet. There's a lot more work to do. Thank you very much. God bless you all, and enjoy the debate tonight.
And as we enter into our first question, I'm just going to let you know you certainly don't need me as a Liberal to tell you that there are political options out there. But we do know that given the new voting rules that we have, not everybody here is a bona fide Liberal. And as a result of that, really part of the evening tonight is to convince those of you who are equivocating. From my own perspective, the other options are intellectually vacuous, socially bankrupt, and politically pernicious. But that's just me. And all those bads do not necessarily a good make. So certainly ask the questions that are going to convince you, if you're at all equivocating, why you ought to leave this room a bona fide legitimated Liberal. So let's go to the first question. And if we can have you state your name and then your question.
Well, I'm hardly going to follow that in an articulate fashion, my goodness. Raj, this question is for you, so I'm going to put you on the hot seat.
I'm sorry, can you say your name first?
Nancy Ray. In St. Albert, Raj, you said you couldn't join the Alberta Liberal Party because it was a little too far to the right. However, at the moment, you seem to be asking for a return to the Alberta Health Premium, which is in fact a form of taxation, which suggests a little bit of allegiance to the right. Would you care to address that sort of inconsistency for us?
Fantastic, thank you, Nancy. So we're off to a good start this evening. We're going to go to Raj first, because when a question is directed to a particular candidate, we'll begin with that candidate and then provide the other candidates with the option of responding as well. So Raj?
I believe my statement was the Alberta Party, Liberal Party, has been too left. If I'm the Alberta Liberal Party leader, on the fiscal side, I plan to move the Alberta Liberal Party to the right of centre, to where most Albertans are sitting, and keep the humanitarian side being an inner-city ER doc exactly where it is. Pertaining to the healthcare premium, number one issue is we actually have to look at our expenditures. The question was how do we pay for everything? So first, let's look at our spending to make sure we effectively and efficiently use our resources, which is less government, fewer ministries, more efficient healthcare. I can fix healthcare, it's a number one expenditure. And if we needed extra money, then I would bring back a progressive, public, non-profit healthcare premium, only if we needed more money. But right now we have lots of money. We're just not using it effectively. To put it into context, thank you.
Thank you. As the microphone is moving towards aforementioned mail, we will take a question from Twitter. So the first question from Twitter is the following. In terms of funding for municipalities, what things are or ought to be priorities? And
having traveled the province, what you see is that government has picked winners and losers between certain municipalities. What we really need as a province is prudent, good, future provincial planning. When you bring on 6 major projects all at once, the municipalities don't have the ability to prepare for the labour workforce that comes in, and that's what stresses society. They need sustainable, predictable funding. In healthcare, we brought in 5-year predictable funding plan. Municipalities even need more stable, predictable funding. And you really have to look at the infrastructure, the roads, the safety side of things, the fire, police, EMS is in the healthcare system, but really let's look at the school system, linking the school system and the province and the municipality working together, using the schools as community hubs and using the tax portion, education proportion of the property tax, not only to work with the municipality, but also with the school system. These decisions must be made collaboratively together. There's only one taxpayer, and that's you.
I'm going to go to the question. And if you can state your name.
My name's Ron. I find here in Alberta, because we're sort of royalty-based, that the government income comes up once a few years when the oil's high, and it drops down. And I also find our funding changes dramatically to different programs based on how much money we're coming into. What's your thoughts, or how would you plan to stabilize our income coming in to allow more steady commitment of funds to the programs?
Wonderful, thank you. So a question about stabilizing the economic order of the province.
The government has a spending problem, an income problem. What they really have is a management and vision problem. After I got elected, I said, be careful with your spending because I predict the US is going to go bankrupt. Oil's going to hit $40 a barrel. Why? Because the Americans drove 19 billion miles less. The US is teetering on the brink of bankruptcy. They've hit the debt ceiling. Our 3 biggest threats are the US economy, an international policy on carbon, and an economy that's so carbon intensive, and water. If you really want to fix things, you need to add value to our economy. Let's upgrade our product. The Premier's broken his promise. We're shipping the topsoil. When you upgrade your product, you build value and yet knowledge-based jobs. We're not just a bunch of laborers who's shipping the raw product to the US and across the world. Let's expand our markets to Asia. The US can't afford our agricultural forestry products. Let's go across the planet. But most importantly, the knowledge of the economy of the future is the knowledge-based economy, the IT and healthcare and research, and let's use the universities to fix the knowledge-based economy and incentive. Thank you.
We're going to combine 2 questions submitted by Twitter, and that's because they both have to do with the general topic of sexual politics and gender politics. So it's always difficult to throw a double-barreled question at candidates, but as you're running for leadership, I'm sure you can handle it. The first question is, to all of the candidates, if elected, would you push to reinstate funding for gender reassignment surgery? And the second question is, California recently signed a bill including gay history specifically in the high school curriculum. Would you, as a candidate, do the same in Alberta? So both of them relate to gender politics and sexual politics. Yep, I will repeat the questions. So the first one is, if elected, would you reinstate funding for gender reassignment surgery? And the second one is, if elected, would you follow in the footsteps of California and pass a bill supporting gay history specifically in the high school curriculum? Give you 10 seconds to ruminate about that one. We're going to begin with Raj, going down the table.
When I was in government as a parliamentary assistant, I was in the foyer when I found out the fact that Minister Lightford had gotten rid of chiropractic and gender reassignment surgery. As a physician, I would absolutely bring back the funding, because these are medical issues, and it's only 7.5 million. It was a bad decision. I don't know what the gay history issue in California is, but what I can say is we need to repeal Bill 44. I did not agree with it at caucus. I didn't vote for it. It's the diversity of our people that makes this province and this country unique. The fact that it doesn't matter whether you're black or white or yellow or big or small, or what color you are or what your sex is, that you are all created equal in this great nation. It was a bad decision, a wrong decision, and that's why I think we need to change this government.
Next, please. We've got a few questions here. Where's our roaming microphone right now? All right, so what we're going to do is this gentleman here in the striped shirt, we're going to begin with him, and the next question is the woman in the black and white behind him.
Hello, my name's Peter, and I'm going to address a question that I actually never seen in any of the literature, and the reason that I came to this meeting is I haven't been in politics at all, any party. And that's why I want to ask this question, and I want everybody in this room to think about it a lot. Because right now I want to find out what you do for accountability. And my question relates to, for example, the Law Society of Alberta is run by lawyers. Lawyers are one of the least respected people in our society. Now, the same thing happens in the police commission. The same thing happens in the healthcare system. There's no accountability. If I go to a doctor, who's accounting that he's making a proper...
Is there a question? I'm going to have to ask you to get to the question, Peter. So
it is. I'm asking the question is about accountability in every sector of the government. The healthcare, because doctors are paid when they're not curing people. The judges that are making wrong decisions are not accountable to anybody. The people that in the police force, when they make a problem, it's accountability to the government, every single sector.
Thank you, Peter. I think we understand the question, and I really truly appreciate the question. So
that's the question. So what would they do to the accountability of everything in the government, the healthcare, the police?
Thank you. Yes, thank you, Peter. In fact, I'm going to restate the question simply and summarize it as a question about opacity and accountability in various sectors of society and governance. So
And here's the problem. What we have is we actually have a sick democracy. That's the underlying problem. And accountability, Peter, is the key. You're absolutely correct. We need to look at how we run our democracy. I introduced a private member's motion to have fixed election dates, so elections aren't called when they're convenient for the governing party. Secondly, recall legislation. That needs to be debated on the floor of the House. I introduced a private member's motion to cut back the wages of Premier and Cabinet back to pre-2008 levels and cut back on transition allowance. This is public service, not getting rich off the public. In fall, I was trying to introduce the strongest performance accountability measures on the #1 spending issue in the nation, healthcare, which is going to hit 70%. And the government called me crazy at that time. What we need is performance and accountability in government. We need less government and efficient government. We need to have this open, independent judicial inquiry into the issues that are raised, and the truth is, for the most part, come out. We need to improve our access to freedom of information and a forensic audit of your books. Thank you.